I'm Amber Olson. I'm a veterinarian here at Chaska Valley. This is my friend Dolly. We're gonna have a video for you to learn a little bit about your new pet and our recommendations to keep your pet healthy. Whenever you bring your pet to the veterinarian, we do an exam from nose to tail that includes examining the mouth, the eyes, the ears, listening to the heart and lungs, feeling their joints, feeling their belly, and checking out their skin. The different vaccines that we have available are Bordetella. Bordetella is a vaccine that helps prevent against a type of kennel cough. We recommend this vaccine anytime a dog is going to be exposed to other dogs. Distemper is a vaccine that has multiple coverages on it. That's a vaccine that we recommend for any pets. They have it covered for a year. After they've had their initial ones, they're covered for 3 years. Rabies vaccine, which is recommended for all pets due to the human health risk. I know, good job, Dal. So the two other vaccines we carry that are considered optional vaccines are Lepto and Lyme. Lyme is really common in Minnesota and transmitted by ticks. And Lepto is a bacteria that's transmitted from animal to animal and animal to human, and it's through urine. So the pet doesn't have to become in contact with the other pet that has that bacteria, just the urine. These are considered optional because depending on what your pet's exposure is going to determine if these are vaccines that you would like to have for coverage. Now, if you have a puppy, we're going to vaccinate every 3 to 4 weeks until the maternal antibodies are completely waned around 16 weeks. And if your dog is an adult and you're just starting vaccines, the veterinarian will let you know what kind of series is recommended. Vaccine reactions are rare, but they do happen, and they can include swelling of the face or paws, or a hive reaction, vomiting, diarrhea. If you notice any of these things, please call your veterinarian right away. However, things that are expected is a dog to maybe be more tired than normal, or sore after a vaccine. And those you wouldn't have to contact your veterinarian if you notice after having vaccines. Dogs can have different intestinal parasites that we are concerned about, and we check for using fecal testing. Puppies commonly have intestinal parasites. They get them from their parents and from the other puppies in their litter. So what we recommend is that you pick up stools right away and dispose of them. Wash your hands because these intestinal parasites can be transmitted to humans. And give dewormer on a scheduled period. If you have a puppy or a new pet, we typically deworm with a product called Priantal. It's a yellow liquid that we give in the mouth, and then 2 weeks later we have a dose that we send home that you can give at home. After that period of time, we recommend doing heartworm preventative as a way to deworm your pet. Heartworm preventative not only prevents heartworm, but a lot of intestinal parasites. Since there's not one dewormer that deworms for everything under the sun, we recommend doing an annual fecal check every year. For ticks and fleas, there are 2 main products that are offered here at the clinic, NexGard and Bravecto, and those are given either once a month or every 3 months depending on the product. Flea and ticks are common in Minnesota, and our cold winters actually don't stop them from infecting your pets. So because of this, we recommend giving flea and tick preventative all year round. So Dolly and I are going to go over some behavioral things that are recommended if you have a new puppy or a new dog of some sort. The things that I like to recommend are making sure you touch the ears, the teeth, and the nails often, and give rewards. So see, Dolly is very excited about these rewards, and I want her to keep these experiences positive, so I'm just going to constantly hold treats in my hand and reward her the whole time that I'm touching her ears. Good job, and I'm actually putting my finger in her ears and moving it around. All right, Dolly, let's do your mouth. Touching her mouth. And you can even, depending on how willing they are about having you touch the mouth, you can even introduce a finger brush. Here you go, Dolly. And I'm just rubbing it in her mouth. Good job, honey. And she's munching on treats while I'm doing it. We're just keeping it positive. And then from there, you can actually add toothpaste to give an even more positive sensation and help with the brushing of those teeth and keeping them healthy. For nails, I like to actually not just touch the paw. Hey, that's a good girl. But I like to squeeze the nail as if I'm a nail trimmer. Good job, honey. For socialization, I would recommend taking a pocket of kibble. I usually use the regular dog food unless they're very anxious dogs. Then you want to up the ante and give a high quality treat like lunch meat, or we like to use these lean treats here in the clinic. Oh, yes. And expose your pet to anything that's new. And that would be our socialization recommendation, is not just to see your neighbor's dogs over and over again, but also meet new dogs, new people, a woman with an umbrella, a tall man in a hat, going places and giving treats for being exposed to those new things. For potty training, we want to make sure that they're understanding that going outside and going to the bathroom outside is what you want as an owner. For potty training, I want you to praise in 3 ways. When your pet goes outside, I want you to praise with treats, touch, good job, Dolly, and a verbal praise. Don't just say good job to your pet. I would recommend using a keyword. So, for instance, if go outside is your keyword, and then she does her business outside, you praise and say good outside or good potty, whatever phrase you'd like to use. Scolding your pet for having bathrooming in the house will actually just lead to your pet wanting to do accidents away from you instead of recognizing that you don't like it in the house. So I see that puppies will struggle with potty training when they're scolded, and what'll happen is the dog will actually pee or poop behind the couch or downstairs, not recognizing what you want is for them to go outside. They just think that they're not supposed to do it in front of you. For biting, instead of closing the mouth and saying no, I want you to redirect with some sort of toy. And then also, if the dog bites your hands, I want you to say ow and pull your hands away so that they are not thinking that you're playing with them. Young puppies tend to bite their each other's ears and each other's face as a way to play. So being in their face and saying no when they don't understand the word no is very confusing for them. We recommend spaying and neutering between 6 months of age to a year. Depending on breed and medical conditions that your dog might have, your veterinarian may recommend something different, and they can go through the pros and cons of when to spay and neuter. Typically, we like to spay prior to a dog going through their first heat, because that way it reduces the chance of mammary cancer. Neutering early will help prevent behavioral issues, but speak to your doctor about any kind of concerns you might have. Microchipping as an option for your pet. It helps return your pet to you if they were to get lost. In order to microchip your pet, we use a syringe and needle that has the microchip in it. And once it's implanted under the skin, we're able to use a scanner to read your dog's microchip number. Some people prefer to microchip their dog at the time of a spay and neuter, but it can be done at any age. Just talk to your veterinarian about pros and cons and what type of microchip, and also how to activate your microchip. For diet, if you have a puppy, I recommend feeding a puppy food until about a year of age. For large breed puppies, due to their bone growth, it's important to have the vitamin and minerals that they need at appropriate concentrations. So I recommend feeding a large breed puppy food. As of right now, we're recommending avoiding grain-free diets and raw foods due to the link to some heart disease in some breeds. After a year of age, we recommend feeding an adult dog food. And if you have a mature adult dog, then a mature adult dog food. Please feel free to consult your veterinarian about any food recommendations or any diet that would help prevent or treat any diseases. There are different pet insurance that are available, and I'm happy to work with any company that you might have. There are tons of different benefits to having pet insurance, and there's not one pet insurance company that is better than another. Just make sure you read carefully on if your pet insurance that you're interested in getting, it provides preventative care coverage, or if it's only for diseases that have not been previously diagnosed. For emergencies, feel free to call the emergency clinic located in Eden Prairie. We have a kit with all of our information that was covered in this video. There are pamphlets on all the products and services that we offer and that we were discussing in the video. There's also a couple of magnets, one including our information, and then also one with the Blue Pearl Emergency Clinic information. There is toothpaste and a toothbrush, neck guard and heart guard if you're bringing us a puppy today, and a USB that includes all of our handouts for our puppy and new pet visit. So thank you for watching this video. We're so excited to have your new pet join our family.